about a year, I sat behind a desk and watched the fire engines and the ambulance go by, and then went, okay, what's my paperwork? And this is where I ended up. So this career it's a bit of a unique animal. It is built upon a foundation of technical competency, which is what you guys were starting this year. But it has some elements to it that are different than a lot of other career choices. One of them is teamwork. There's very few careers where you can be as integral a part, close with your team members. And I think some of it is also what you experience, the intensity of what you experience with your team members, that really makes it special in a lot of ways. Developing the capacity to perform under stress, which I'm sure Instructor Brown and his staff have tried to recreate for you in the classroom many times. Is that fair to say? A little stress in the classroom. Yeah, as an instructor, why do you need to make it so hard? Well, because we can't replace the stress of what you'll really feel when you have to do that and somebody's life depends on it. Or they're screaming at you in pain. There's all these things that add stress because you're human, like everyone else, and it's stressful for you. So that's part of the plan in your training. This career is one that stresses lifelong learning. Learning kind of never stops. You feel like you've accomplished something sometimes, but then you look and see how much more there is to know. And if you think, the minute you think, I'm ready, I can see it all, I got it all, the bells go off and you go to a call and it completely stumps you. And you realize, nope, I got to go back, I got to learn about this. So it's opportunity after opportunity after opportunity to learn about something, and it's different. It's good if you kind of like shifts in attention, which I do. And of course, it's built upon service to others, which there are other career choices. For me, it was a very important choice to say, I want a career where I can show empathy for people, and I can make a difference for them. And you don't make a difference all the time, but you are definitely placed in opportunity sometimes. You can and do. So you can truly make a difference in the lives of others. Sometimes you can even literally save a life, which is the ambulance or calls the fire department. For you, it gets to be just another call, but to them, they will always remember the day that they called the ambulance, or always remember the day that they called the fire department, even if it ended up not being a really significant day from the standpoint of somebody really hurt or anything. They'll always remember when you come, and they'll always remember when you were there. There's not too many careers where your interactions are that much a sentinel event in the people that you serve. So it's kind of different in that way. So I would encourage you to explore that. Get out there and do it. Find a place. If you're going away to college, find a place to volunteer. Find a place to work part-time. And give it a try. Just see what it's like. Even if it's working in healthcare or maybe not even on the ambulance. You now have a valuable skill. I should say after next week, you will have a valuable skill. And one that puts you in a position. So my advice is very simple: just take advantage of that opportunity. Congratulations. Again, on behalf of Fire Chief Goddard, job well done.
At this time, we'll give Principal Evans a few minutes to say a few words to us. You do feel like you're
the key thing, and the reason why I don't want to stand back there, is because in just a little under a year, well, 9 months, school year, these folks have just been a tremendous group to be associated with. And I say that because I meet them every morning, and I eyeball them every morning, and they eyeball me back. And they have such a good fortitude for discipline and an attitude that they're going to take care of business no matter what. All your business, you come in and you speak to them. Every one of them. not too many of you guys spoke to me. But you all did. And so what that has done, that has convinced me of what I thought in the very beginning, when I first met most of you, that the academies here are special in general. They are. They have special curriculums. They have rules that are established that there's not too much of a, a tweaking point for rules. The kids will get sent back to the home schools. But that being said, the EMTs are way above those basic requirements. And as I look, they're way above. So there's a double whammy there. They have an opportunity to make sure that they get certification that's going to be second to none, that they're going to be able to get in an organization or other organizations that are well respected and are based on discipline, based on knowledge, and based on love of fellow man. What I could see, how I associate with these young folks, they're going to fill that bill perfectly. Okay, I congratulate you. Really carry on a reputation that when you come to the ARL, we mean business. We want you to be successful. Right. Carry on.
I guess I'll stand up here too. I think like that. Evans, I'm sorry. Always been a big supporter of the program. And although I haven't seen him a lot, I remember the first time we met. I was in the lobby at Long Beach High School, and the program was in its infancy, just starting. It was a pilot program. And then I think it was lieutenant or captain.
It was Captain.
Captain John Jerome.
Chief promoted me. And I was hoping he would send me to the field and say, well, I need you to go to training. And by the way, there's this program I want you to work on.
And Chief Butler was, either I just promoted him, I think him and Chief Jerome were probably two of the brightest people I'd ever had an opportunity to sit down and interview. And I thought, I wish I had the kind of talent these guys had. Both of them were paramedics. Both of them were passionate about the job. And both teachers. And everybody said, if you can get candidates to teach this program, they will get the best education that any instructor can give them. And so I talked to Mr. Brown, and he agreed. And he brought Chief Allen, and the rest is history. But they were a big part of this department, and the EMT expertise and the pride and the passion that went into the emergency medical services in Howard County. And I can tell you that I've been a lot of places becoming EMTs or joining the force of first responders. So I'm going to say, before I forget, I'm very proud of all of you. And once you get out there, and you've done that a couple times, it becomes easier to do it. It's easier to step out there. It doesn't mean work gets easier. It means that the work probably gets tougher, but you rise up to the challenge. And you guys have really risen to the challenge. And once again, let me say I'm very proud of you, and I'd like to applaud your efforts.
Again, it's a pleasure to be here in front of this group of supporters, parents, legal guardians, friends, but even more importantly, this group of young men. Before I do say a few words, there are two more people I need to introduce. One, the gentleman walking back and forth there. Mr. Jeff Brown, paramedic in Anne Arundel County, one of the sport instructors, who without him, we could not do this sport. And for one of the students in our class, it was a revelation about 3 weeks ago that Mr. Jeff Brown is related to whom? It took 8 months for him. Anyway, the other person I'd like to introduce, who has been a friend of the program, came from Baltimore City Police Department, homicide detective. And when you first came here, I was a little concerned that a homicide detective was coming to this school to do security. I found out that there was no connection whatsoever. But Mr. Barry Fee, if you would please stand up. Barry looks out for us, comes to the classroom once or twice a day, not because of security problems, because of his interest in what we do in emergency services. When I again look at the group, we have guests. Find it, folks. That's a cue that they've done very well. And because in this class, we only have adults. There's no room for any other type of individual but adults. And I've kept my promise, and it was very, very easy to do. We only deal with adults. We have seen a transformation from juniors entering the senior year to the men and women that you see in front of you. Now, it wasn't without trials and tribulations, and some of the things to the parents, guardians, etc. Some of the things that this group of professionals did, types of calls. They did the routine vital signs, oxygen suctioning, patient assessment, but they also are out there doing bleeding, bandaging, fracturing, splitting fractures and injuries like that. Several of the students assisted in confirming a patient was deceased. One student confirmed that a patient was deceased as a result of a hanging. Students responded on the crews, responded to calls where they took patients to referral centers, burn center, shock trauma center. They were exposed to communicable diseases, blood, airborne, HIV, and even one student, when we were talking about communicable diseases, and I quote, "I got pooped on." So anyway, several of the students, by legal definition, were assaulted. Some of the students got to see folks that were on the scene of some of their calls get arrested by the police. Many of them did CPR, chest compression. Many of them bagged the patient, bag valve, literally had the life of that patient in their hands. I think one of the students was doing that for over a half hour. That's how much the crews, and that's how much the hospital trusts what these young men and women do. It literally allows them to have that person's life within their hands. Cardiac arrest, quite a few on cardiac arrest, and even one student had the opportunity to watch a patient or work on a patient twice on the same call going into cardiac arrest. Don't ask me how that happened, but the patient did get kick-started, and then they tried to revive him, but didn't quite make it. They also perform skills in front of large crowds, in the mall and elsewhere. And I told them early on that when that sort of thing happens, you're going to see two categories of folks. One category of folks that like to look and see what's going on, but not get involved. And then along comes the fire rescue service, the EMTs, big crowd, and as the EMTs, these students, walked up to that crowd, what did that crowd do? Parted, and they went right in and performed in front of those individuals. Now that itself is stress, because you never know who, number one, is in that crowd, doctors, nurses, lawyers, people with cameras, so that itself creates a lot of stress. But they are the ones that, when the emergency occurred, No one else wanted to go near that patient. These young men and women walked with direction right to the scene. There's sort of a parting of the waves, went in, started to treat. Let's see, skills from the crowds. Oh, we even had Mr. Brown. When you walked through that classroom door that very first day, you were given respect. Not because of anything you did, but because of what the class did the year before. Walking down these halls and walking in that classroom, you were given respect by the administration, by many other folks. Mr. Brown and I finally decided that you have earned our respect, that you have made the grade of being a professional, trained emergency services provider. Mr. Brown and I finally agreed, concurred that you have earned their respect. The bad news is, you only got about 4 or 5 days left of the school year that you all can boast about that. But the good news will be is that you will now be able to pass along your respect that you worked so hard for, that you earned this year, and you're going to take that respect and now you're going to pass it along next year to the incoming class. Now, just like you did, when you first came in, you didn't earn that respect. That was based on what someone else did. You now are giving that hard-earned, well-earned respect to a bunch of folks that you don't even know. And that's just the way. The best way I can express my profound respect for you, you as EMTs, and future members of the fire service family, is that should a situation occur where myself or my family members are in need of emergency care, you may be laying on the ground, and as a patient, I am sure I'm going to be rather apprehensive, uncertain of what's going to happen, but knowing I need assistance. And while I'm laying there, I may very well hear the sirens blowing. I know the ambulance is coming. I don't know what's going to happen to me, but I know I need help. I hear the ambulance stop. I hear the door shut. And I hear those footsteps coming toward me. I hear those footsteps stop. And what do I hear? I hear, I'm from the Howard County Department of Fire and Rescue Services, and I'm here to help you. My name is Desiree, or Amy, or Justin, or Joey, or Stephen, Michael, Walt, Kiara, Glenn, Sean, Kimberly, Frank, Michael, and Stephen. When I look up and I see your face and know that you're there to help me or my family member, I know at that moment in time that everything is going to be okay. I'm in the hands of a professional. I can't give you much more of a formal respect than that. Take care of me anytime. Ladies and gentlemen, I thank you. Chief, all righty. And if my dignitaries can stand up.
Desiree Bazzioni. Amy, you know.
Give me from the top.
Justin, work in. Donald, Joey, Carol. Stephen Condor. Michael Fraser. Noel Ibad. Sean T. Madden. Michael. And last.
We get a Kodak moment here. Or a digital, I guess we should say.
Okay, so let's just take a moment for the graduates to stand and give them one collective hand of applause. Class valedictorian. In recognition of your outstanding academic performance and skills during Paramedic Pathways Academic Class number 9, which resulted in graduation at the top of the class, this year's valedictorian is Amy Goodman. It's typically almost trademarked by the ARL Excellence in EMS Award. I'll take a few minutes to read a little bit about this. The ARL Excellence in EMS Award has been created to recognize a single student who demonstrated superior initiative, perseverance, and resourcefulness during the EMT basic portion of the Pathways program. Areas such as teamwork, leadership, classroom performance, skills in academics, role modeling, maturity were all taken into consideration. Donald R. Howell, retired battalion chief for Howard County Department of Fire and Rescue, and was and is a pioneer in EMS for Howard County as well as many other jurisdictions throughout the state. He continues to serve as a role model for those around him. He is highly respected by his peers and subordinates alike. His reputation is unprecedented in EMS at all levels. Chief Howell started his career in EMS as a volunteer in Ellicott City in early 1968. Since that time, Chief Howell has become more and more active in promoting EMS and elevating the standards of patient care, not only in Howard County, but throughout all of Maryland. The ability to move EMS forward has always been difficult. Technology in medicine constantly changes. Minds don't always keep up with these changes. Realizing the importance of emergency medical services at all levels, first aid, Red Cross in the 1960s, through EMT aid in the 70s and 80s, to cardiac rescue technician in the 1970s through the 1990s, and ultimately to EMT basic and paramedic in the 1990s into the 21st century. Chief Howell constantly worked and continues to work to move EMS further into the forefront of the fire service. Chief Howell has served as a role model to EMS providers and instructors throughout this country. His influence has directed individuals to expand their abilities beyond the fire service as well. There are physicians, nurses, and even doctors, directors of state EMS systems, who consider Chief Howell a leading influence in their career path. The recipient of this award should be highly honored for being recognized for their achievements in the field of emergency medical services at such an early stage. Furthermore, each and every student in the program was fortunate enough to have Chief Howell assist them directly during the EMT program as a co-instructor. This year's recipient of the Donald R. Howell Excellence in EMS Award is presented to Mr. Michael Scanlon.
This EMT program, this Paramedic Pathways program, is a collaborative effort. It started with the vision of Chief Herb and the tireless energy of Mr. Brown and many others to get this program off the ground. But please understand that it is a collaborative effort between the Howard County School System, Howard Community College, and the Howard County Department of Fire and Rescue Services. Without their collective participation, this program would not be the success that it is. This program would not be an academic pathway to a true future within emergency services or elsewhere. This is where Mr. Evans will come in. This program within this county, within this school, is head and shoulders above every other similar program within the state of Maryland. Mr. Evans, I believe you, sir, just attended a seminar or whatever where you all were comparing notes. Would you like to sort of share what you learned? Or?
Well, I ended up being the center of attention because just being from Howard County, there are 24 jurisdictions as far as counties and school systems. And there are a good many counties that do have paramedic or EMT programs, but they're more related to fire training cadets as opposed to EMT, because EMTs are evidently the academic investment in EMTs is very, very rigorous, and people sort of shy away from the EMT pathway, and if they want to stay in the fire service, they lean towards being a firefighter, which is not bad, but it just shows the complexity and the enormous academic rigor that's associated with our program. And our program is growing because of these adults, professionals, spread the word, and are true role models. So while most of the programs are sort of withering away because they can't get the scholastically oriented academic students who are leaning towards the EMT program, our program here in Howard County is flourishing because we have the right stuff.
To add to that, this curriculum in here is the only curriculum within the state that is geared towards an academic future. All the other programs, they are, you take a class and good luck with what you do. This is we view this as an academic process that you start here, go to Howard Community College, where thanks to the combination of, again, Howard Community College, Howard County School System, the Howard County Fire Service, and I'm sure members of the council and the executive's office have funded this program and provide the scholarships for you all to continue at Howard Community College to either get an associate's degree or a certificate in paramedicine. This is the only jurisdiction in the state of Maryland that does that. And we are looking beyond just being a representative to the Howard County Public School System for providing the excellent learning opportunity for students of EMT Academy Class number 9, this date, May 10th, 2012, and it's signed by all of the students here. Direction. And these are two of the leaders right here that at one time sat right there, but have now taken the little candle that I had, and now it's a big searchlight that these gentlemen are taking to the next level. And my hat is off to them, and we're looking for you all to be folks that will be doing the same thing. So, on behalf of the students, sincere appreciation to the Howard County Fire Department for providing the excellent learning opportunities for the students of EMT Academy Class number 9, this date, May 10th, 2012. Chief.
The same kind of perspective that John and I have developed over the years, but I don't think you realize what he's done in his career, what Mr. Brown has done in his career. these folks have been doing this for a lot longer than John and I have. And they were leaders. What I would ask is that the students and some of the parents, if you could send a message, a serious message to Mr. Brown. He'll be undergoing surgery again tomorrow for
How's everybody doing today? Are you all enjoying your cake? Because I'm enjoying this graduation. I didn't write anything down because I'm more of a spontaneous kind of speaker. I'm kind of opening up for my friend Mike here. He's got everything all, focused and oriented. But I just wanted to talk about a few things. I remember first actually knowing that I was going to be in this program. I remember I don't plan anything out. My mom always plans everything out. She's like, Frank, you're gonna be in the EMT class. I'm like, what? What? Okay. I mean, before I took this class, I'd never known anything about what an ambulance, really did. You call 911, but you never really get that background as to what it is that we actually do when you call 911 and all those details. So I remember previously, before we even stepped foot inside this building, we had to get interviewed by Mr. Brown just to be able to be accepted into this program. I remember talking to him. That was some pretty scary stuff. I had nothing to say, but I basically, I was in there. I told him what my plans were, and he took it from there. I remember stepping in the classroom, not knowing anybody. Mike has some few things to say.
So I just wanted to say on behalf of the students here in the EMT class, I want to say thank you to all the instructors and school faculty that we have, but also Howard County Fire and Rescue for allowing us to be on your ambulances and get hands-on experience like no other academy here actually gets. At the beginning of the year, there was 22 students in this classroom, and they were all trying to become EMTs. For various reasons, some of them left, some of them just decided it wasn't for them. But that number grew smaller to what you see today of 14 students who have made it all the way. We didn't just become EMTs, we became a family, as Frank stated before. We shared a lot of fun times, a lot of difficult times. There was a lot of stressful times, especially closing towards state boards and all that. We worked together as a team. We were always a team-based thing. If one of us screwed up, we all screwed up. So I just wanted to say that if we did something good, we would all get rewarded. If we did something bad, we all had to pay for it. After making this year very enjoyable and giving me an experience that I want to forget. Thank you.